mic was off and I was frozen. Yeah, the mic was off. So what I'm going to do is repeat it. Ordinance number 303-2025 as amended by Councilmember Conwell and Griffin by departmental request. It's an emergency ordinance to supplement ordinance number 549-2023 passed May 22nd, 2023, to add new section 10 relating to a grant from Ohio EPA for operation of Division of Air Quality, to add authority to enter into a contract with Teledyne API for the purchase of air monitoring equipment. Ordinance number 303-225 have been approved by the Health Department, Director of Finance, as well as Mark Griffin, the Director of Law. Sir?
To the chair, thank you.
Mr. Chairman, this is Patty. Just the amendment is to strike 10 and insert 5A in the title line. So that is the change. Instead of adding new section 10, it's adding new section 5A.
Okay.
Thank you.
All right, thank you. Let me put that on the record.
Oh, sorry, and just to clarify, do we need to make that amendment here at the table today?
He did read it into the record,
Okay.
but, so you should be good. Thank you.
Let me strike it. Sir?
Okay, yes, through the chair. So this is a part of our air quality monitoring program funded through the Ohio EPA. This is an amendment to the original legislation that this body passed to allow us to enter into contract with Teledyne API with new funds that the Ohio EPA has awarded us to allow us to do this specific function that we believe only Teledyne can help us do. And with me today, for any questions, are Commissioner David Hearn, Division of Air Quality, and the Chief of Air Quality Monitoring, Brian Sokolowski. Here for your questions.
All right.
Good morning. This expansion of additional funds that are being made available by Ohio EPA will allow us to expand and conduct some maintenance on several of our air monitoring locations and devices within the city. And this will allow us to keep doing what we do when it comes to monitoring the air quality. Teledyne is the manufacturer of many of our air monitors, and this will expand and also allow calibration and maintenance of the equipment.
You have nothing to say? Any questions? Council Lady, you have any questions?
No, honestly, I was going to ask if you were from the Sokolowski family of Sokolowskis. That was the questioning more I had.
Unfortunately, I'm not. But Bernie and his family were always very nice to us. Free T-shirts, you know.
Oh,
T-shirt
that's
great. So it was a shame when they closed.
Yeah, absolutely.
Very
I know.
much.
I miss the pierogies at every lunch.
Oh yes.
No, thank you.
I don't have any questions, but I talk with you about this, directors. Air quality is very, very important. And, we can't take it lightly. And, in some areas of the city, even in the county, is worse than the others. And I understand even with the redlining with air quality, with the lack of trees and where a lot of the pollution is at, this is very, very important. And this council, we don't take this ordinance lightly. All right. A matter of fact, you guys presented in front of us, I think it was earlier this year, and I remember that. And we'll bring you back later to get an update for the summer when the lawnmowers start moving forward and other air quality issues, idle cars. This is serious with asthma and all these kind of effects that affect us in the city.
Thank you, Mr. Chairman.
So with that, no questions on ordinance number 303-2025. Let's batter up, move forward.
Thank you.
Sir, you're moving with 188. Council Lady. did a good job narrating last time. I remember you did a good job. But she didn't go on the tour with us, did she?
No.
Okay.
Through the chair now.
I went back, I took a look at some things, and I have some stuff written down also.
Good.
All right, let's move forward.
188.
188. So what I want to do, so, because it's a lot of
Or
details.
through the chair, we could do the presentations first if you want. It's up to you.
No. I'm going to do 188, and then after 188, before we do 189, I'm going to ask some questions on that 188.
Okay.
All right? Thank you. Move forward.
Thank you, Chair. Shannon Leonard, Chief Zoning Administrator, Zoning Manager. So I've been working with Dr. Margolius here as well as our attorneys here as well with counsel in terms of this package here. And so just quickly, we'll go through the purpose of legislation, background information, proposed smoke shop amendment, the proposed window signs amendment, and also code amendment, and the tobacco retail licensing amendment. And these are all a package of 4. So the purpose of this legislation is to regulate the location of the smoke shops, to protect the public health, safety, and welfare of all Clevelanders, to protect neighborhoods from negative externalities and secondary effects created by the concentration and clustering of such businesses, to avoid and reduce oversaturation of these types of businesses, as well as to promote the public health, safety, and welfare by encouraging walkability and prohibiting signage that is 100% opaque, full window coverage in all business, industrial, and overlay districts.
Now, you was going to give us some background history. I thought you had on there that you mentioned background history.
Yep, I'm going
That's
to walk
not-
you through that here in the presentation.
Okay, you got it there.
Yep.
Okay, good.
So,
All right.
as
Sorry.
some of you may, no problem. As some of you may remember, under Ordinance 529, 2024, we established Section 347.191 to amend our retail sections, our business sections, as well as 34502 pertaining to the location of the state licensed adult use and medical marijuana dispensaries, cultivators, processors in alignment with the state of Ohio. And the reason we did that was because after the 2023 election, in which adult use marijuana became legalized across the state of Ohio, we needed to implement regulations for the city of Cleveland proper. And as we were going through the council process, one of the main things that kept coming up was these smoke shops that are popping up on every corner. And at this time, prior to this legislation, we don't currently regulate for smoke shops. But just to give a little bit of differentiation, under the state licensed medical marijuana and adult use laws, it's highly regulated under the adult use cannabis code in the ORC. And some of these things, kind of just outline quickly, these adult state licensed facilities require security systems that are pretty high tech. They also have regulations around storage of product behind locked areas in safes and vaults, as well as additional regulations on displaying product, including the amount and how the cannabis can or cannot be stored in cases for public viewing. Their hours are limited, and there's strict advertising regulations. So this is really important. We talk about the window signage here in a few minutes, but no product license is to be displayed to the public or directed towards children. No use of cartoon characters. They're not permitted to depart from the registered name, so they can't use slang terms for paraphernalia and other cannabis products. They also suggests or indicates location of the product has been falsely endorsed by the division. So this is a common complaint that's coming through the city, is that we have dispensaries that have popped up all over the city, and they're not actually dispensaries. And then the division of Ohio Cannabis must approve all depictions, representations, and branding for those state licensed facilities. So the current state of marijuana law in Cleveland is that the current regulations are permitted in our local retail business districts, but they must be at least 500 feet from churches, parks, schools, daycares, rec centers, and libraries. And these are the current permitted areas in the city. And you'll see that there's a direct correlation of where this is right now, as well as where the smoke shops are popping up at. And so Another thing that keeps coming up, again, like I said, everybody's saying dispensaries are popping up on every corner. These are actually the only state licensed facilities currently in Cleveland. So you have Brook Park Road, Prospect, St. Clair, Lakeside Avenue, Lakewood Avenue, and West Third. And then there's a provisional license currently going on at 5100 Pearl.
Point. No, Chair, so basically for this slide that you're showing right here, if this location is not, if the location that got a dispensary in the city of Cleveland is not one of these 8, maybe 7 different locations, they are illegally distributing cannabis in our city through the chair?
Through the chair to the councilman, these are the only state licensed adult use or medical marijuana facilities in the city of Cleveland. And in fact, they're required to put this sticker, Division of Cannabis Control, on their window facing the public right away for the public to view, so that you can see that it's an actual state license. If they don't have this sticker, or they're not one of these 7 here, they are not legally state licensed in the city of Cleveland.
And that's why we have this legislation in front of us to be able to have
So we can regulate.
grounds to regulate them illegally distributing cannabis in the city of Cleveland, correct? Through the chair.
In tobacco,
Yes.
that's correct, through the
Yeah.
chair to the councilman. So this is just giving you the background information here about the state license facilities and what they look like on the interior and exterior of their facilities. These are, again, just another example. And as you can see, they're highly regulated by the state. So again, this is part of 4 ordinances. The first 2 are zoning ordinances, and the other 2 are the criminal code as well as tobacco retail licensing that Dr. Mogolius will walk through. So the proposed smoke shop legislation that's before you today is for existing and new smoke shops in Cleveland. Currently, we have no regulations. There were 42 formal permit applications to establish use of smoke shops since January 1st. That was prior to the Planning Commission meeting. I've now had 35 more come in.
Wow.
There's over 400 technical that we believe are, based on Google and other searches, over 400 smoke shops that are existing in the city of Cleveland currently. And so what Dr. Mogolius will explain is the tobacco retail licensing. They will have to make sure that there's an occupancy file, a use file on file with the City of Cleveland's Building and Housing Department. But just to give you an example, and then these photos here are actual shops here in the City of Cleveland, so you can see the literal floor to ceiling sales of these products, of public viewing. As well as the signage that you're seeing here, and that these are the most common signs that we're getting complaints about from residents as well as some of your council colleagues.
Yeah, we'll deal with the advertisement. We'll deal with that.
And so the proposed smoke shop legislation is actually defining what a smoke shop is. It's any retail establishment at which 20% or more of their floor, shelf, and/or display areas individually or in the aggregate is used for the sale of smoke shop products such as kratom, CBD, Delta-8, and other cannabinoids. Also tobacco and nicotine products, electric smoking devices such as vapes, and any accessories to the above, so papers, water pipes, cigars, things of that nature. This does exclude state-licensed medical marijuana facilities as well as adult-use marijuana facilities, which are regulated by the state. And in addition, any application for use the property as a smoke shop will require a shelf plan showing the 20%, similar to our small box discount legislation.
You know what, speaking of regulations, let's say a smoke shop, could they get a liquor license to go with that smoke shop in the long run? Because you could do both. Liquor and wine license.
Through the chair, I'll have to look that up to see. I think that would be separate processes, but yeah, unfortunately, we didn't see any of that on our walk.
Right.
Yeah.
But you know, when you go to the gas stations and they have liquor and wine,
Yep.
they also have smoke shops
Right.
there. So you got the two together. So, when we put clouds on the liquor license, you could integrate the two, the smoke shops, if there's issues and concerns as a nuisance. I went back we went with Councilwoman Santana. I went back and I took a look at things. I look at it and I asked people how much it costs to start up smoke shops and everything. A little walk done, it means something to me, but I saw the other things.
Yeah.
And I saw I understand the startup cost as well as the retail for liquor and as well as that. Now, that could be a big threat. The other big threat is that some of these guys, and I'm not pointing to you, you look at flea markets. They could even have this in a flea market in our community. You see what I'm saying? So then your startup costs won't cost that much. And you don't have to do the painting or whatever the case may be, or put up a shelf. You see what I'm saying? So you gotta look at risk and threats. So we're gonna take a look at the flea markets also, monitor and control that, because that could come in and come right into the process. That is a threat as well. I mean, continue with that.
And then, just so you know, the image here on the right is the new permits in the past 6 months as of earlier March 2025. And so the information here is limited only because Building and Housing just now started adding smoke shop as a category for us to get the data to pull the products. But you can see where the concentrations are these new smoke shop applications. And again, most of them fall in Councilwoman Santana's ward along Pearl Avenue is where the latest of a string of permits has come in, but it affects the entire city, really. So any new smoke shop, additionally, in defining smoke shops, we've also put in place requesting a buffer that any new smoke shops have to be at least 2 miles or 10,560 feet from any other existing smoke shops. And then no smoke shop shall be located or relocated within 500 feet from a church, public library, public playground, public park, or school. And then the Director of City Planning will maintain a map of existing smoke shop locations and other information noticed to determine compliance with the space regulations. And the map that you see here is really just a heat map of all the known smoke shops based on the data and where the highest concentration is. It again follows that permit map that you just saw. The second part of the legislation from a zoning perspective, which is really important, is in enacting 350.121 to limit window sign coverage to a maximum of 25% of all window area. This is really important beyond the smoke shop legislation, in that each facade is considered separately, all windows and glass portions of doors. It pertains to all temporary and all permanent signs. Transparent signs are measured also. And this is really important because for many years we've had to deal with a lot of complaints coming in about full window coverage of signage. And there's like a little bit of a loophole in our code about where that 25% falls. And so the proposed smoke shop legislation with the window signage, as you can see here, I believe Councilman Slife sent me this, and of one of the smoke shops here in the city.
The dispensary.
Yep. They're claiming dispensary, which I think is really important because the state licensed facilities don't allow you to false advertise, whereas under this, we don't have anything to really stop this, but we can stop the full coverage of windows because this creates a public safety hazard in terms of public walkability, not only for people in the store, but people also outside the store. You can also see that they kind of diverge away from the actual smoke shop products and start talking about some of the paraphernalia and other things, as well as using slang and things like that that are not permitted for the state licensed facilities. Here's another example. Again, like I said, that we are getting a lot of complaints about these smoke shops calling themselves dispensaries, and residents actually thinking they're the state licensed dispensaries when in fact they are not. Again, this is another example of the smoke shops and the full coverage window signage that we get a lot of complaints about, not just the advertising, but the full coverage and creating a public safety hazard. And then I'm showing you this final picture because this one kind of really calls out that this is not just a smoke shop issue. This is an issue across the whole city in terms of all of in a lot of our commercial corridors as well as our industrial corridors where we have full window coverage. And this really creates a safety hazard in terms of patrons, but also residents, especially ones with buildings, up at the right of way, and wanting to have some transparency and blend what's going on the private as well as the public realm. And so that's very important beyond this legislation for smoke shops, is to address that 25% window coverage. So instead of it being regulated by a square footage amount based on the frontage of your building or your unit, we're saying all window signs on any facade or wherever you have transparent doors and windows can be a maximum of 25%. And from there, I can.
So how would you measure, let's say, in your mind, you have a window, here's 100% here, but if I don't have a measuring, how can you enforce that? Because my 25% may be different than your 25%. So how can you measure that?
So you measure it based on the linear frontage in feet of your, either your unit from party wall to party wall, or the linear frontage of your entire building. And then we times that to get the 25%.
So would you have someone out there to measure it? Are you going to do that? Have someone to measure it?
Through the chair, yes. And when we discuss the legislation in 187, that's the health inspections. So we plan on doing these measurements and incorporating this as part of our checklist for our tobacco retailer inspections.
And just to add, any signage requires sign permits. So when they submit their sign permit package, we do that for the zoning code to do a review. And if they don't meet that 25% or they exceed it, we send them a letter of nonconformance and they can appeal it at the Board of Zoning Appeals.
Okay, good. Were you finished with your presentation?
Yeah.
Through the chair, so I could keep going through 186 and 187 if you would desire,
They're
or
all
we could
full.
stop here.
Councilman Starr had a point when you got finished, so I'm going to yield to his point.
Okay.
Starr?
No, I had a few questions. I just want to get down.
We'll hold it.
Yeah.
We're going to go through the presentation, we can do the flow,
I'll wait.
and then we'll come back and get all of that. We just write it down. All right.
Okay.
Thank you.
Great.
Put you down too. You down, Chair, Vice Chair?
Yeah, no, continue the presentation.
Thank you. So legislation 186, so 186 is updating our language to match with the state Tobacco 21. As you all know, City of Cleveland passed Tobacco 21 locally here in 2015. The state followed suit and passed Tobacco 21 in 2019. And so 186 is just a routine update to update all the language to match with the state law. 187 is the tobacco retail licensing. So earlier you heard Shannon discussing smoke shops, which are defined by that 20% shelf space or floor space, and so purely dedicated to selling nicotine or cannabinoids, et cetera, et cetera. Tobacco retailers are any store or flea market that is selling nicotine products. And with this legislation, all tobacco retailers are required to have a tobacco retail license.
Go back. Let me see. Each tobacco retailer engaged in the sale of tobacco products shall secure, but we didn't put flea market in there. I might do a motion on that
So
later on.
any individual firm, partnership, joint venture,
Gotcha.
association,
Gotcha.
joint stock company,
Yeah, that falls in
we
there.
covered our bases
Yeah, that falls in the
through the
paradigm.
chair, but no, thank you for that
Listen,
point.
I
And
got
so you'll see the map, and we don't have an accurate number of how many tobacco retailers are in the city of Cleveland, but we've done our best to calculate that out.
What's your assumption, about 450?
Well, through the chair, so Shannon noted that 400 just smoke shops, so then you add in all the convenience stores, all the stores that are selling nicotine products. I think I probably underestimated with my 400 to 600, and it's obviously just changing so quickly. But you can see the density throughout the city. So tobacco retailers would be required to get a license. So this is something, this placard is something that we'll be able to do, just like we do with restaurants for tobacco retailers that haven't picked up a license.
So when they get a license, I know I can step in, do you require them to also make sure they have business insurance and workers' compensation for their workers? To cover all of that?
Through the chair, I don't think that's a requirement for the tobacco retail license at this time.
Where's money coming there and you have a tort, someone fall or something like that? So we have to protect the public to make sure they have business insurance. We'll look at that, when you come back to finance
Okay.
or whatever.
Okay.
We'll talk about that as well as making sure they have workers' compensation. You got to make sure they're right, and all their paperwork from the state.
Okay.
You know.
Yeah, through the chair, we do require that they have an occupancy permit and the correct paperwork from the state, and so maybe that's included in
That
some
might be
other part.
included in their business. But take a look at it for me. sir.
Okay, through
All
the
right.
chair, absolutely. So to be a tobacco retailer in Cleveland with this legislation, you must be open to inspection by the Department of Public Health, our Division of Environment, during regular business hours, and this is the same language that we use for food safety operators. Tobacco retailers will be subject to at least 2 compliance checks annually, which is where we do inspections that are routine, and we can do complaint-based inspections. During those inspections, we ensure that there is signage for Tobacco 21, as we did on our inspections, that they're not selling to anybody under 21, and that they're also verifying identification by asking for ID.
Got you.
We're also come up with a whole checklist of whether or not they're doing the signage and additional work with partners, learning from Columbus and Cincinnati. If a tobacco retailer fails their inspections or fails to, if they have a license but fail their inspections, they'll get a first violation is $500, second violation within 36 months is $750, third violation is $1,000, plus a 30-day suspension, and then a fourth violation will be another $1,000 with revoking of the tobacco retail license. Now, if they don't get a license at all, they will get a placard once the ordinance is fully active. They would get a cease and desist until they got a license. Okay. I'm sure you have a lot of questions.
Council lady?
Yeah, sure.
The vice chair always go first. You know, I'll go in and out asking questions anyway.
Yeah, thank you. I know a lot of us have been waiting a long time for this day, and we're excited to see this move through the committee process. Could you share a little bit about what happens to the existing density of smoke shops after we pass this legislation? Obviously, we don't currently meet the 2 miles is for new, but the 500-foot rule, will we be forcing people to relocate? What do we do with the existing density?
Through the
chair.
Oh, yep, sorry. Through the chair to the councilwoman, thank you, that's a great question. So any smoke shops that are legally existing as of today or that submit a permit prior to the, this ordinance going through, we will have to apply the current regulations. And so they can continue to exist in perpetuity unless they change their use again or try to expand their use. If they are then within 500 feet, we would make that determination at that time.
Okay, thank you. And, this is, I think, a great example of why we need to keep this moving, right? We've seen other cities, we are already behind the 8 ball. We are already had a proliferation of these open, even within the last couple of weeks and months, it has just become they're proliferating, right? And so we need to get a grip on this. I emphasize with all of us that we need to move this along as quickly as possible. One thing I learned when these dispensaries really started opening in the last couple of months, you had a picture up of the one called The Reef on West 25th Street. This is on the border between my and Jasmine Santana's ward. And this one was the cause of a lot of heartache, this one, the Reef. And one of the things I learned when talking with the police about what to do, given the rules we had at the time, was that essentially there are strains of marijuana that are regulated under the state of Ohio's new laws, and then there are others that are allowed, quote unquote, allowed under the hemp, like the American hemp law, and that the police were telling us that they did not have the ability to test between the two. And so how are we going to, in terms of the regulations that tobacco retailers and smoke shops cannot sell marijuana regulated by the state of Ohio, how are we going to tackle this argument about the loophole of the particular strain of marijuana? Through the chair.
Question.
Through the chair, it's an excellent question. It's definitely something that will keep me up at night once, hopefully, when the legislation is passed, because it's going to be really tricky. But I'm going to lean heavily on our partners, on what Columbus is doing, what Cincinnati. We're going to advocate to the state to help us clarifying the different rules of the different THC strains and that sort of thing. And if we have to enter in a contract with a lab to help figure this out, that's what we'll do, because it's really important. So thank you for that.
Yeah, absolutely. I mean, I think we're going to have a minimum of number of weeks to pass this because of our committee schedule. I think we need to pin this down right away, because I already know they're going to be saying, well, this is Delta 8, this is, available, this fall, what is it called? The American Hemp Farm Bill. It's the Farm Bill. Okay, I apologize. I was misremembering. But this is already going to be the loophole, and we saw in the great video with IdeaStream, director, chair, you guys and Councilwoman Santana went to smoke shops, and in the video you can literally see these glass jars filled with what to any college student looks like marijuana. But if they're going to say, no, that's Delta 8, and to my understanding right now, we do not have the testing ability to determine between those two, this will fail. And so we need to get that part of it in place through the chair, and I really want to make sure we have a path to be able to test between these different products.
So let me ask you another question. When we went on tour and we visit the smoke shops, mushrooms, are they legal to sell? You don't know. You nerdy. But mushrooms, are they?
Through
No,
the
they got these
chair.
mushrooms. I don't know the
Yeah,
name of them,
there's
but I
all
can
sorts
take a
of
look.
psychogenic
I went back.
substances. Thank you for
Right.
doing that. So yeah, no, I agree. And to the councilwoman's point through the chair, so the law, as it's written now, there's a 180-day ramp-up period. There's also a Preventing Tobacco Addiction Foundation that has who's in the audience, who has discussed with helping to fund the implementation of the program through a contribution to the city of Cleveland. And so if the legislation passes, that would be the plan, to get to the road and start figuring out all the answers to these questions, setting up meetings with Columbus, Cincinnati, Michigan, figuring out what, how to do this.
So let me ask one more question real quick. Could they, when they're ready to start up, have you ever taken a look at their business plan? Because it would tell us the direction they're going in. And because, they're profitable. They make a great deal of money a month. I'm not going to say how much they make. I have an assumption. They make a great deal of money when they start up, but they wouldn't do it. And when we went to where Santana took us at, there was a lot of foot traffic. And that's where your concentration at. They're concentrating on mainly with the foot traffic. They're not going to places where it's small density. They're going where high density is at. And that's why she have a saturation of smoke shops. All right, I went back by myself and I went talking with people, and I see the density that's there. And that's where it's at.
Through the chair, yeah.
Just try to get
through
their
the chair,
business plan
I
and
haven't
look at
seen.
something.
Yeah, I haven't seen the business plan. I mean, I think of the 4 smoke shops we visited, the 3 that let us in, I think only one, probably would have been, the one would have disclosed to us kind of some of the margins there. But I think our job will be to regulate the health and make sure they're not doing illegal activity based on the City of Cleveland ordinance, and then working with the state and federal government on
We got to be
how
able to
do
look
this.
at things to see what's going on, so we can get, you know what I'm saying? We're not requiring it, but we can get a hold of it. That way, how can you plan without seeing a plan? You see what I'm saying, Council Lady? So we got to try to get that. And I yield, sorry.
No, thank you, Chair. Could you also clarify, of the 4, which are the 2 that need to go to city planning and DPS?
Through the chair, we're going to do our best to keep them as a package and 4. So
Okay.
it would be 188 and 189.
Okay.
Need the
They already went.
And they already went to city planning, but they'll need a couple weeks' notice for DPS. So there's no interest in moving forward on the 186 and 187 sooner than later, so that we can try to prevent this density issue. People trying to get in under the wire.
Well, through the chair, the 188 and 188 is what would stop the
What
density.
would stop the density.
So yeah.
Alas.
I know,
Okay,
I
it was
know.
worth a shot.
I know, me too. I came in with, I didn't know about the 2 weeks. So, yeah.
So about the applying for a tobacco retail license, we do have a lot of the people who own gas stations, corner stores, largely small business owners. I briefly want to ask some questions that they might ask, such as what will the application process for the tobacco retail license look like, and I think you had a little bit about the cost, but could you share a little bit about the cost and process through the chair?
Sure. Yes, through the chair. So we're going to do this just like we do with food safety applications. So for the cost methodology, we'll do a calculation based on the number of hours, the salary of the inspectors that are doing the inspections, the number of hours that multiplied by the number of retailers that are out there. We estimate a cost of between $300 and $500, and
Annually?
yes, annually. And once we do the exact formula, we'll propose that through the Board of Control annually so that it changes from year to year. The application process will be also similar to restaurants. We will hope to get it into our software so that it is as easy as possible. We'll have 180 days to do that, and so we'll work with all the permitting process to make sure that we're doing it as seamless as possible.
Thank you. And as part of those tobacco retail license inspections, I know the state does test buys. Would the city also do test buys to enforce the law through the chair?
Through the chair, yes.
Great.
So, yeah, that's the big deal. So the state does them very intermittently,
Yeah.
Rarely, and there's the penalty when the state catches someone selling to someone under 21, the cashier, the person working, is penalized. This legislation, which is a best practice across the street amongst local jurisdictions, penalizes the business.
Great.
Yeah, that should be penalized.
Yeah, and a number of suburbs had already been doing this, and so we hope to catch up.
Great. And I will yield after one last question, which is, I have kind of gotten radicalized through the process of seeing all these open in my ward, seeing the effect on the community, and just understanding what they're actually selling about some of these loopholes, and particularly things like kratom that are, essentially opioids that are binding to our opioid receptors, and Delta 8, which is currently you can buy at a gas station all around the city. Do we have any ability as the city to regulate those products? And what are our steps to making sure that we're not selling what are essentially controlled substances at gas stations and corner stores? Through the chair.
Through the chair, yes. So in thinking through next steps, we do think it's a good idea to move forward as is, but there is the ability to, as we get our health inspections up and running, to come to you with a list of ingredients to specifically end the sale of within the city of Cleveland. And so definitely would like to keep that conversation going.
All right, sooner than later. Let's do it.
Okay.
Thank you. I'm in 110% support of this legislation. I think this is a critical package that we need to pass for the quality of life and health of our city. And I'm very grateful to the director and to city planning for getting it to the point it is right now.
You're good. Good job. Councilmember Richard Starr.
Thank you, Chairman Conwell, as well as Safety and Zoning, for coming here to discuss this ordinance. Some of my questions I definitely just want to understand for clarification is, what is the formal process for state licensed marijuana dispensary application? What is that actual process, and how does it take place for a business? Through the chair.
Yeah, through the chair to the councilman. So I'm just going to give you a summed up version from the city side of the state license process. So the state license, originally prior to the adult use passing, there was only a certain amount of licenses available to the whole state, and they were selected through an application lottery process. And then after the adult use passed in 2023, again, it's another type of lottery type process. I can give you a contact at the state for the actual state process. There's an application and there's a significant amount of money involved. And then what they have to do before they open in the city of Cleveland is they submit to us, or to myself, a notice of proper zoning form, finding out if they meet the regulations not only from the state but also based on our 347 and 343 guidelines that passed last year. And then once they do that, they submit their application. If they're chosen by the state to have a license, then they will then submit for occupancy permits upgrade their location and go through the typical building and housing process.
Okay, and through that state process, do the city have any authority to handle that process? I know the state has a process, meaning just because the state say yeah to them, do we have to say yes as a city, or do we have any legislation where it require council support of that business prior to any other formal process? Through the chair.
Through the chair to the councilman, there's no process from the city side outside of the zoning code regulations that were passed last year. But for particular business, if they applied at a specific location, there's no actual process of where I believe the council weighs in.
Yeah, but through the chair to our staff, could we possibly take a look at other cities who maybe have something in place? Because I take it as a point like, okay, you are able to get a license or the state say yes, but do we have anything to say, well, if the council doesn't approve this application, you just can't just open up? Because I think we need to really regulate who's opening up business in our city. And I believe having a all hands on deck approach with this, we can all be able to see what's going on. Because what I look at and see sometimes, I pop up in my neighborhood, and next you know, I just see a sign, and I just see somebody say they got a new dispensary. And then based on that list where you show that there's only 7 that are state licensed facilities, that is becoming a problematic because it's just popping up every day, popping up. And at those dispensaries, my office has received calls where they were stating that some young people are receiving or buying marijuana from these locations, and there's nothing that really can help us regulate. So I definitely am just trying to see if we can look at if there could be some type of legislative authority or process that needs almost similar to the liquor license. I know the state can still override the city, but if we have a issue from a city level, from the council level, it would need our approval as well to be able to go on with that application, just to require that. So through our staff, I definitely would like for us to look at that. Even if other cities don't have that, I think it's no problem with us being first to look at some different things, because this is a problematic issue. And then I know you spoke on this a little bit, I think, Director, through the chair. Like, what is the actual process once these ordinances and this is passed for your department or any department in the city of Cleveland to regulate or shut down some of these illegal smoke shops? What would that actually look like, and what would be the process or the time frame? Through the chair.
Hey, Councilmember, can you answer the one about the liquor license one?
Yeah.
So we can regulate that, and then you do your A and B.
Okay,
Is that cool?
no problem, Chair.
Sir?
Through the chair, there's two processes. So one through zoning, which I think Shannon could describe of how someone is applying for it to be a smoke shop, a new one. And then I can talk about how we're going to regulate the existing ones. Is
Yep.
that okay?
No problem.
Through the chair to the councilman. So the way that we will regulate the smoke shops, any smoke shops in the city is going to require an occupancy permit. And so when they submit that permit, that occupancy permit is required through the licensing program. So the licensing program, just like every other licensing program in the city, they make sure that there's, for instance, like used car lots, they make sure that they have an occupancy permit on file. And so if they do have if they're seeking an occupancy permit, we have a map of the existing permitted locations based on our permit software. And because this has hit the news, people have sent an influx in terms of applications into the city. Like I said, there's probably been about 75 since the start of January of this year that have come in. And so once hopefully this package passes, when those permits come in, if they're within 500 feet of another, we would write them a letter of nonconformance, and they could seek a variance at the Board of Zoning Appeals, and then that way, council could weigh in. And then I'll return to Dr.
Thank you.
Yeah. No, through the chair, thank you for that question, Councilman. Once this legislation, if it were to be passed, we would begin a campaign of emailing, mailing, putting flyers up on smoke shops that we find on Google to say that, by 180 days from when the legislation passed, you need to have a license. We'll have instructions for how to apply for that license. Some smoke shops, I imagine some that we visited through the chair to the chair, will not apply for a license, and so we know what to do in that case where we do a cease and desist. But the ones that do apply for a license then would be subject to inspections where we would have that checklist to go through to make sure they're doing everything above board. If they're not, there's that penalty schedule, which fourth warning or a fourth penalty is a revoking of the license. And so we'll have a lot of tools in our tool belt that we don't currently have.
Yep, and thank you, Director, as well as Ms. Shannon for the explanation. But within context, what would be the reason for 180 days through the chair as opposed to 90? Just asking.
Through the chair, no reason. I mean, you know, it's going to take some time to figure out some of this, some of these questions, the minutia of how to tell different legal versus illegal substances to give fair notice to the retailers. But the zoning amendments, which I think you're equally concerned about, that would go into effect, I think, right away, or 30 days, right away, I can't remember.
Through the chair to the councilman, generally, it's a 30-day requirement after it passes, unless you guys waive to make this an emergency ordinance.
Yep, and through that process, just want to make sure we get a handle on this because, you know, when you start thinking about churches, parks, schools, daycares, there's quite a few that are already existing and operating currently in the city. So I think this legislation is something that is very important for us to really be assertive, intentional as a council to get this passed, but also in the process making sure we have the resources in place. So through the chair to the team, rather, do we have enough staff that can have oversight to help us with this? Because one of the issues is we could possibly pass and give you the authority to hold a lot of folks accountable, but do you have enough staff in each department, where in your department, that can actually go out? And also, what is the relationship with something such as building and housing or economic department or any type of enforcement from the police department to help with this? Because if you only have a 5-person team or a 10-person team, and we're talking about 75 then put in application, what
Yeah.
about the other 75 who have yet to put in applications? You know, how can you really have the infrastructure in place as far as the staffing levels to have oversight of this through the chair?
And let me get a point in with them. I'm big on execution. So what Councilmember Starr just mentioned about having the people with the right workload, but where they execute and who's going to be the supervisor to make sure that they follow through, who's going to make sure that when he mentioned building and housing, as well as planning, and all these people follow through, because you can write legislation, but you have to manage it. Isn't that right, Councilmember?
Yes, sir.
You have to manage the legislation. We can push this here, and it's good, but we need you and your administration to follow through.
And to that point too, Chair, and what is the actual needs? You know what I mean? Because there's certain things that we say we want to be able to test without having to use the substance to test it, but having something in place that you can say, hey, this is illegal, this should not be here, X, Y, Z, and the third. I'm sure my colleagues as well as myself receive those calls about these spots. We'd be able to notify who in the department who's going to go out to execute that, because we have a problem with a lot of execution. Like we deal with different things with building and housing, where we talking about how do we use technology, how do we get inspectors to actually go to the property to get updated photos, how do we get mystery shoppers inside of these spots for us to really say, you know what, this is not okay, because this is not what the law that was passed by the voters was intended to do. It was not for you to give underage, 21-year-olds, underage, the opportunity to buy weed from a store as if they buying candy from the store. You know, those things should not be taking place, and they should not be in walking distance of our schools, our churches, all those different things that should not be happening. We need to make sure we have the right system in place for us to regulate this ordinance that is being passed, and I'll pass it, Chair.
You're definitely right. And in the state, just like the state do with us with the liquor license, we get blamed for that, the council members, because they don't execute.
Right.
So we need you guys to execute. They don't, you just got to. We put this in place. You're championing it, I'm championing it, city council moving forward, but the workers got to execute.
Yes, through the chair. So absolutely, thank you for that line of questioning. We are fully staffed for this group of health inspectors that'll be doing this work. In addition, We have the individual who's in charge of those inspections from Kent City is on our team doing our quality improvement and accreditation, and so he's volunteered to be a part of this. In addition, we have the former Deputy Director of Environmental Health from the county is now our Commissioner of Environment, so he knows about this from doing it in the suburbs, and so he's on this team. In addition, Director David Margolius will be doing these inspections and already did 3 of them with you, to the chair and Councilwoman Santana.
2 o'clock in the morning.
So through the chair, absolutely. And then, and I fully anticipate that we will come to you with the money that has been collected through these licenses when we come to you for the next budgeting period to ask for more inspectors to do this work, because this number, if this keeps growing, we're going to have to be on top of it. So I appreciate you.
Yep,
Thank you.
and Chair, my last question, I definitely would like to
Can I
ask.
finish your point with that again? Because
Go
you
ahead.
asked some great questions. We need you also to visit our community meetings so that you can talk with our residents so that they know the way also, so they can help you, because they could be your eyes and ears, and they listen, they can call. And if we have some kind of hotline number that people can
311.
call. 311, just call it 311?
311.
You know, I like
Yep.
311.
Yeah,
311?
but through the chair, I'll be there as well. And I neglected to mention our health promotions team, some of who are in the audience as well, who are going to be helping with this. So we've got all folks on deck. So thank you.
Yep, and to that point, thank you to the health department, because when I reach out to them for events, community meetings, they be there on a day with presentations, information of what's coming out from the health department, how they can be intentional on getting the support that they need. My last question I would definitely ask, and I possibly would leave this open, possibly to our staff as well, is based on, since this ordinance has passed where a state licensed marijuana dispensary has been legalized in the state of Ohio, do we have any information on the amount of revenue that has been generated? And then also, how much revenue has it been trickled down to the city? Because I haven't seen a dollar or heard a dollar coming into the city from this. And if not, what is actually the governor and the state house doing with that revenue? And is there something that we need to implement, such as resolutions or lobbying, to get those funding back into our neighborhood? Because just off of, social media, you see different articles, and, you don't believe everything you see on social media, but it do catch your eye sometimes when you see it. So I'm trying to figure out through the chair, my question would be, do we know how much revenue has the state generated from legal use or sales of marijuana in the state? And if so, have that money been allocated or distributed anywhere in the city, anywhere in the state, to the different local cities? Through the chair.
Yeah, through the chair. So you're going to get me in trouble with that question. So I appreciate you. But I read those articles. I read those articles too, and that's you're asking the right question. And so I know that policy advisor Austin Davis has been kind of the lead on that issue. But I read what you read, which was $0.
And within that $0, is there, so possibly to our policy and research team, is there something that we can actually do? Prime example, before the state of Ohio passed this legislation and the people voted to allow licensed marijuana to be legal in the state of Ohio, there were other cities who's done it years before us. I wonder to see how their revenue has been trickled down to the to the city, and if there were some things that the local governments had to do to be able to lobby for that funding to come back to the city, because I believe if it's tax dollars on those sales, I believe the city should have those dollars legislated back to our neighborhoods. And what we need to do with down in the State House, as well as with the governor, is let our voices be heard, because I think this industry is making millions and millions of dollars that can definitely go to some usage for our neighborhoods, but also making sure we have the right amount of distributors in our neighborhoods that are doing it legally instead of illegal, so we can make sure that that is being regulated. And I yield, Chair.
Director?
To the chair, great questions. Yeah, I think we're all in this together, all the cities, and so active discussion. I've seen that.
Yeah, because looking at our wards, and mainly in, you look at Central, Glenville, Huff, you look at the west side, and you see the abject poverty, the businesses they're making a great deal of money also. I mean, a great deal of money, council member. The state is making a great deal of money, but guess what? Glenville, Central, Huff, the west side where Santana's at, they're sucking the money out of our neighborhood, and you are putting our people at great risk, but it's nothing coming back. This is serious, you know, that we saw. And I agree with you, Councilman. This is scary. It's very, very scary. So we got to execute. We have to stay on top of it. We're going to have to be willing to go down with the state and talk with them. You know, I mean, with the lobby the state legislators, state senators, you know, once we do that, I got to say, you know, I could burn a letter to the governor or text him on certain things, and just we got to stay in his ear, because it's not good for us that we see. And will you finish, Councilman?
Yes, I am.
Yeah. So I yield to Councilmember Chris Harsh.
Charlie and Councilman House Jones are on the list.
Oh, okay. Did you put him on? I'll get him.
Are they next or am I next?
You-
Am I still
you're
next? Okay. All right. Through the chair, thank you for bringing this in this morning. I do just want to remind everybody, too, the importance of tackling tobacco as a poverty issue. One of the reasons that people in America struggle sometimes to get out of generational poverty is that we encourage low-income communities to self-medicate more than we encourage high-income communities. And for a lot of people, I was stuck in this cycle for 25 years. You can spend $2,000 a year on tobacco, and by the time you're 25, that amounts to a down payment on a house. You know, you are easily missing out on things, not to mention the quality of life that is ruined when you have to constantly live every single day around an internal clock that dictates your behavior. One of the things that shocked me the most when I finally quit smoking was how much time there is in the day. You just have access to all your hours, and you aren't thinking about, do I need to get here, over there? And you just sneak out for 5 minutes. And anyway, this is really important for the financial well-being of Cleveland, because people that get hooked are more likely to be lower income, and it's more likely to hurt them long term. So I just want to remind people that this is also an anti-poverty issue. Couple questions. So Councilwoman Moore got to it right away, and I'm glad she did. The Farm Bill that's creating this exemption. I walked into, and the one that has the no medical license required, that sign is all over the west side right now. They're making these in bulk. That one right there on the reef, right? It says no medical required. The sign is kind of blowing in the wind and you can't see it, but it says no medical required. And these signs are all over the west side. And I walked into the store and I was like, how are you guys doing this? By the way, I'm your friendly neighborhood council person. What is going on? And they're like, oh, dude, we're totally legit. We're under 28%. This is 27%. It's hemp. It's covered under the Farm Bill. I asked a couple officers, and they were like, yeah, man, I think that's the actual, like, we're as confused as you are, but I think that is an exemption. So it's funny that, like, I mean, essentially it's what before legalization you might call ghetto weed. It was that cheap stuff that wasn't very good that was available in parts of town, and if you went out to the Grateful Dead show and played all the extra, you got the really good stuff that they sell down at the dispensary now. We've kept the same market. We're just putting it in stores and making it legal under different auspices. It's very bizarre. But through the chair, my question is, if we can permit for tobacco, why don't we just permit for all forms of marijuana and hemp as well?
Through the chair, thank you. Yeah, through the chair. So we do think this permit, the retail license, will be all encompassing. The stores that are, we don't think there are stores that are going to sell any of these types of products that are going to be exempt from requiring this license. So we think we have it covered. And if we find that we don't, we'll come to you for an amendment.
Well, but through the chair, the current legislation is to permit for tobacco and tobacco products. Why not, through the chair, tobacco and THC hemp marijuana products? Why not throw it all in there?
Through the chair to the councilman, it is all in there. So there's a very long list of words and ingredients that I cannot pronounce properly. But it is on there. It includes all the Delta 8, Kratom, all of those products that are in the Ohio's loophole of that Farm Bill that you're talking about. And then, so it does include all of the smoke shop products so a smoke shop inherently is going to require the tobacco retail license.
Okay.
And so even if you're a gas station, if you have 20% more of your shelf space is given to smoke shop products, in the tobacco, you'll require the tobacco retail license as
That
well.
was the first one that actually worried me, Mr. Chair, because I think people can be creative in how they handle their floor space. So I wasn't so sure about that one, and maybe we just say if you sell any of these products, period. I mean, what does through the chair, maybe explain the floor space, why is that relevant if they just, like, why
So
even
it's
have that there?
relevant, so there's going to be a tobacco retail license needed regardless of tobacco or smoke shop products. It's the smoke shop, defining the smoke shop. One of the concerns that came out that you were weeding out, maybe the mom or dad that sells just tobacco nicotine products, but isn't selling smoke shop products. And so there was a real concern when we were writing the legislation that they would be regarded as a smoke shop and they wouldn't be able to continue selling their typical cigarettes. Not to say that they're any
Yeah.
less important, but in this legislation, that was how the attorneys.
But through the chair, that gets specifically to the zoning issue part of this. That's the 1,000-foot, right? I mean, why is that relevant through the chair?
Why is
exempting the mom and pop that just sells a pack of cigarettes, and why is that relevant to us?
Why is that relevant?
Yeah.
Yeah, go ahead. I'll defer
Yeah,
to the
through
doctor.
the chair, thank you. So we did borrow this from some suburban communities that just did zoning restrictions on the smoke shops. If we were to do zoning restrictions on all tobacco retailers, that would apply to any new gas stations that were selling this array of products. And so we didn't think we'd have the full support of the body to go that far. But if that support is there, then we can change it.
Okay.
Could we have
So through the chair,
Comment.
then making the distinction
Point of
is also-
information, just really quickly.
I'm sorry, go ahead.
Can I ask a question
Yeah,
on
sure.
this point? Thank you, through the chair, to the team. Explain to
not
me
yet.
again, you said you don't think you would have support of the body. Clarify, please.
Yeah, through the chair, so that would mean, so if we did a zoning restriction on any tobacco retailer with that wider definition, that would mean that a new gas station coming into a community would not be able to be built or would not be able to sell
Why is that? Through the chair to the health, why?
because they would be a new tobacco retailer within that 2-mile buffer of an existing tobacco retailer.
So through the chair to the director, Yeah,
Shannon
I did-
has
so
a
I
clarifying
wanna-
point. Yeah.
pulls things out, because I'm listening to the conversation. If you're talking about a mom and pop is not a gas station. So,
Can I? So just to,
Let her finish. Are you finished,
no,
Councilman?
I'm listening to the conversation, and I'm really trying to understand, we didn't want to hurt mom and pop who's selling nicotine, and then we heard gas station. So what
What
is,
do you want to do, Council Lady?
I just feel like everybody who is selling this product that is causing destructions needs to be licensed in some form or fashion, period. It should not matter the scale, because again, on the inside, when you think of the public health ramifications that society pays for,
Yeah, we're paying for it. Right.
which again ends up falling. And when you look at now the conversation that we are talking about, specifically as it relates to Medicaid on the federal level, when you look at the increasing costs in our Medicaid, which is the ABD population, AIDS, blind, disabled individuals with long-term health ailments, there is a correlation to tobacco. So regardless if you a small mom and pop versus a large gas station, this is not about today. We have to look at generations to come and what are the costs to society. So this caveat being made for small business, I think, is irrelevant based on the actual product and the business that people want to get their hustle on. And if somebody can actually show a valid reason as to why there should be an exception for that, then we should have it. This is the time to have the exception. But I would absolutely say that is not my position, right? And we talked about the body, then the body needs to have that conversation. And people that
the
feel
body
this
need
way
to have that
need to
conversation.
actually be able to put that on the record. And please do not cover, for myself, do not put me in that blanket to say, provide cover when we know the long-term ramifications in society and specifically in communities like mine.
I think that what you're trying to do first is trying to get the framework passed you get the supporting evidence, then you come back to us for amendments. You're looking at, this is my assumption, Council Lady, you're looking at if this might be hard to get this through while everybody else trying to get these smoke shops in, you're trying to be very, very, let's say, for lack of a better word, very, let's say very fast, pushing the legislation through, then you can come back with amendments. But if you think that you might get pushback on some things, you don't want to do that right now. You want that framework to go through, so you'll have it. Is that correct?
Well,
Is that my
and
assumption?
through the chair, I'm sorry, so it's two separate pieces. So you're right, through the chair to the councilwoman, that
Yeah, she is right.
every business or individual or flea market that sells nicotine products is required to get a license. We're not saying that some don't. What is unique to just smoke shops through the chair is the zoning restriction that Shannon can speak to.
Well, can
Can she speak to it? Then we're going to go back to your question. We just take
yeah,
over
no.
yours and turn our
So,
back to you.
right. So back to my questions. Through the chair to Ms. Leonard, zoning is my next question. So the 2 mile radius pretty much locks down the whole city of Cleveland. I mean, Old Brooklyn's 2.5 by 2.5, and if you draw a 2 mile radius around the existing smoke shops, Old Brooklyn's done. Where there will be no more permitting once the first couple, and so with the whole city. So my question through the chair is, how do we enforce zoning?
Thank you. That's a great.
Thank you, through the chair to the councilman. So zoning is enforced through the Department of Building and Housing in terms of code enforcement officers who I believe that the department has been hiring more in the last year or so. The biggest thing is through 311, but also the other way is for amending the zoning code or overhauling the zoning code in a way that is clear and there's no confusion for the enforcement officers on to properly enforce the code.
So through the chair, if we determine that somebody is operating outside of their zoning in a location where they are not permitted to conduct their activity, and we need to send out a building and housing inspector to issue a zoning violation that says you are not allowed to conduct that activity at this location, that is a violation of zoning, and that would be a VN that would have 30 days to comply, or 60 or 90 or something like that. Is through the chair, is that correct? Is that the step-by-step process?
Director?
Yeah, so for the process is if you call 311 or you send an email complaint to the Department of Building and Housing, what will happen is they will send out an inspector who
Yeah.
will then, if they're in violation, they see that they're in violation or see a violation, they'll issue a violation notice. They have so many days to address that violation. But as it pertains to specifically tobacco retailers, I believe the director has stated that their department will handle those violation notices.
Okay, and through the chair, then to the director, how would you go about doing
Yeah,
that?
through the chair. So thank you. We have experience on this with restaurants that operate without a license. And so we work with the law department, who's been incredibly responsive. We put a cease and desist letter out to them and a placard on their door, and work with law enforcement as well to make sure that they cease operating without a license.
Okay, and so through the chair, would the police eventually go out there and stand there in the morning and say you can't open?
Through the chair, in our experience, that's rarely necessary, but we do what we need to do in circumstances.
I'm asking because of other reasons, like there's zoning violations throughout the city that we just like functionally don't have the infrastructure to enforce. Like I've got people operating in the wrong place, neighbors are upset about it, and I'm like, someday we got to get building and housing down there to issue a violation, but get in line, good luck. And if it's non-violent activity and it's non-directly threatening, it's low on the totem pole, and enforcing zoning is been sort of a constant headache. I'm wondering if our better solution here isn't to focus on the permitting side. I'm excited about the permitting side, and I think that this is the right way to go. I'm a little wishy-washy on the zoning in terms of being effective. But through the chair to the director, we think there's about 400 already open. We've got 77 applications or something in the pipeline. Will we be capping the number of permits available in the city? Through the chair to the director.
Are you asking about through the chair about the retail licensing?
Yes, correct.
Okay. So, no, we didn't have a plan for a cap in this current legislation, but certainly open to that discussion.
I think we might need to have that discussion either today or like, yeah. I mean, if we had 1,000 permits, that would not help anyone, right? And if we limited the number of permits available, we could do a lot. And also, if the price on those permits, I think you said the price is going to be set by the Board of Control for the licenses, I think this body might want to have a discussion about how much those should cost. Are we talking about a $500 license, a $10,000 license? If these guys are making $20,000 a year on these shops, which
Well, they
is
make
like
more
the
than
rumor,
that.
right?
Like a month,
Okay, 20,000. I'm sorry, 20,000 a month. Yeah, that's what I meant. My bad. If they're making, you know, $250,000 a year on these shops, maybe a $50,000 license to sell. Like, I mean, we should maybe have that conversation, right, here at the table, out in the open. Then let the Board of Controls come up with later on, and then we all have fights about whether or not the license cost was effective or not.
Through the chair, thank you. So the licensing, we're going to link to the cost of doing the work, the inspections. So the estimate that we have is 300 to 500, but we could definitely, I'll show you the math as we're doing it.
Yeah.
And we'd like to be able to change it every year based on the labor costs.
Yeah. I guess, thank you for
So let me ask
the
you a
number.
question. You think we should do the motion at the table now to let's say, to put a ceiling on how many smoke shops? And you think we should do, we sit back and we study, we look at where you at, and then we do
Yeah.
a motion to put a ceiling on it?
Through the chair, so two things. So one, the zoning restriction is going to stop new smoke shops, as we've discussed. And so as soon as that goes into effect, that will stop. And we know, obviously, it's effective. Otherwise, people wouldn't be flooding to get their applications in right now. And then the second thing, in terms of limiting the number of retail licenses that we're able to do, the Ohio Revised Code likely would prevent us from that limiting. It's not, I'm not talking about zoning, I'm just talking total licenses. So, but we could absolutely ask the legal team to look
It's
into
interesting
that.
because we limit the number of liquor licenses in this state. I mean, every single year you buy them off other places. Go ahead, Councilman.
Yeah, point of information. Hey, this, how, through the chair, I mean, again, to the person who's hi, Stephanie. Can you, to our law department assistants on the table, is there a prohibition of limiting or limiting permits of any type of product or business? Well, how is it, and if that's the case, how is it then that people limit so anything? Some communities limit housing vouchers. Some people limit liquor licenses. So what is preventing the city of Cleveland of limiting these establishments, which are really new, and we have yet to come up with a community-centered approach to a new industry, which absolutely needs to have a way that can be incorporated in community, because many of the people whose business this is don't live in this city, and they don't have these type of operations in their community. And if it's so profitable, then they can absolutely do it in their community. But what you will find out in the policy, they can't.
Right.
So this whole luxury, every business is not good. Every business is not good. And again, if that's something with community and all that type of stuff, we absolutely need to be a little bit more disciplined in what we say is unacceptable, and setting some standards, some real standards that can be enriching to our communities, and being fair, and equitable. And I'm not saying this state policy that we have, there are a whole bunch of flaws, but to have anybody doing whatever they want to. And many of us know that there are illegal cannabis shops operating in our communities with zero enforcement. And you cannot tell me that our Department of Public Safety is unable to enforce when you know they should not be operating. But to our law department team, hi, can you talk on this issue, talking about we need to ask the question to our legal team about, is there a prohibition on setting limits when it comes to a new industry like the cannabis industry, as far as who will be able to distribute or not?
Thank you, Mr. Chairman. To the councilwoman, when we walk the line between the state regulations versus our regulations. So the cannabis, or if it's regulated by the state, that's governed by the state, right? So I'm writing your questions down furiously. I am going to check with Stephanie Melnick because I think this was looked at the time, but I want to verify when this was being crafted on that question. So I will get on back on that. But as it relates to the cost of administering the policy versus the creating an illegal tax, that is why we are limited in the amount of dollars. We can only charge what it costs us to administer the program. Otherwise, if we try to charge a $10,000 when it only costs us $500 to administer that program, that's what's considered by law an illegal tax.
So no-
But the number, I don't have the direct answer for you as to can we limit the number? I think the answer may be yes, but I want to verify that with Stephanie,
You know what,
with Ms.
Councilor,
Melnick first, our corporate
I'm
counsel.
after him.
I know you'll be next after Councilmember Slife.
Well, I'm sorry, we're still on my time, Chairman.
We only got 1 minute left. We've been
I have more than 1 minute left.
asking great questions.
My questions are so good. It's
They're
taking over the
good.
conversation.
I know, taking over the conversation. They're
So I need my
great.
time
Not
back.
be- better than good. Council lady, I'll meet with the director. We will write that down, and then we'll meet with the law department because he has to go through 2 other committees with Councilmember Anthony Harrison, Child Council Chair, as well as Finance. So we could put that down when we in those committees. So we'll meet with the law department. I yield back to you.
Yeah, thank you, Mr. Chair. I'm glad I brought it up because I think we
Stop
do need to have this
asking great
conversation. No,
questions,
we need to figure this out. I agree with the
good
council
stuff.
lady.
Yeah, I agree with
The
you.
state liquor commission charges like $10,000 for a liquor license, right? Maybe we need a commission. Maybe that's what we should do. Create a commission, make the cost of enforcement go up a lot, and then we can raise the cost of licensing. But through the chair, you said that there are about 400 that you've already identified that exist in the city somewhere.
450.
450, great. Smoke shops, right. And one reason I'm excited about this, Mr. Chair, is that I actually think that the Department of Health can do enforcement. So there's like 250 work days in a calendar year, 5 times 52 or whatever, minus vacation. So if you had to inspect them both twice a year, that would be 1,000 visits, which you could do and if you visited 4 a day. If one person visited 4 a day, they could easily go to every single smoke shop in the city. And that's not crazy. That's not like hard work. That's one person split it up and make, that seems really, really doable. And I don't think that we're going to run into a problem where we do this and all of a sudden the health department can't get somebody out there to do the inspection. I trust that you'll get the inspections done. So that's an encouraging thing to me. I think the question about licensing fees, about the number of licenses available, about whether or not the Board of Control should do that or Council should do that need to be resolved. I agree where we're trying to go with this. I think the fine structure, I worry about fines not being large enough when people are bankrolling off breaking the law. So maybe we want to look at that as well. And I don't know if we can do that right now during my questions, but I think that this is the right direction. I think we should ask ourselves those very real questions about the number of licenses available and the actual cost of the permit. And I understand that there's obviously there's laws involved, but I don't know. Could we look creatively at the permitting schedule? Does it have to be annual? Can it be every 6 months? Can you get permitted every month? I don't creating a back. I'm maybe just talking out loud and making a mess of the thing, but there's usually a creative workaround when you want to find a creative workaround. And I think that if we're trying to nip this in the bud, no pun intended, then we should do some of this work on the front end. I yield. That's all.
Through the chair, I look forward to getting the answer, getting some text messages that maybe we can get limited. So yeah, we'll definitely look into that. For permitting,
Yeah, could we do that semi-annually?
through the chair, I don't, let's, anything's possible. Let us get this up and running and,
We are humans from
I told you
Yes,
that's what he wanted to
exactly,
push. You want to push that. You want to push this framework
yeah,
through.
yeah.
All right, Councilmember Charles Slife.
Thank you. Good conversation. Many of my questions have been asked and answered, so I will maybe build off of some of them. I would just like to say, and I would like to talk about this offline, the strategy of bringing all 4 of these through as one group. I would disagree that that's the most strategic way to do this. Let's talk about that offline. So thank you for including the picture, Shannon, of the place on Rock River Drive. Just here's a dumb question. Where's the state? Like, why because I'm getting calls. There's a dispensary within 200 feet of Valley View Boys School. How is this possible? Where's the state? And I'm glad that we are coming up with our own mechanisms to tackle this, but Ohio Liquor has like every resource to kind of nickel and dime businesses, in my opinion, often going a little overboard. But this cannabis division seems to be absent without leave. Why? And the reason I'm asking is because I also want to understand not just where the state is and why the state doesn't seem to be enforcing this, but also when it comes to obtaining licenses through the city of Cleveland, does having received some sort of violation, not from the city, but from the state, potentially impact one's ability to get a license from the city of Cleveland to sell tobacco?
Through the chair to the councilman. So the Division of Cannabis Control does not regulate the smoke shops, and I don't believe that they have any input on the smoke shops themselves. The smoke shops are a product of what Councilman Harsh was discussing about the U.S. Farm Bill with the loophole and the types of levels of hemp that can be sold. These products that they're bringing in are not regulated at all in terms of and I'll defer to the director here regarding, the oversight and the need for the retail licensing or the licensing requirement in addition to the zoning requirement in terms of the products that they're selling. The Division of Cannabis Control is specifically for the state licensed medical marijuana dispensaries as well as adult use dispensaries, but are not pertaining to these pop-up dispensaries that we are now defining as smoke shops.
Sure. So, and thank you. But before you answer, I guess my question is around really the use of the word dispensary.
Yeah.
If the dispensary is something that is legally defined by the state, why is the state not citing and shutting down businesses that are masquerading as something that should be regulated by them? This to me is equivalent of, me opening up a bar in my garage and telling come on over. But me opening up a bar in my garage selling Bud Lights and telling the state of Ohio that, I'm not operating as a bar. They would shut me down. They wouldn't say, oh, well, you're right. You're not a licensed restaurant bar, so you're good. You can sell Bud Light out of your garage. So is there some drop in how the state is regulating? Does the state not view this as something to regulate? I guess because Councilman Harsh was right, that sign's popping up all over the west side, and you can go in and they can say, oh, well, we operate, but the sign says dispensary. They're saying it's not a dispensary. That's a falsification.
Through the chair. Thank you for that line of questioning.
And I want to believe that the state of Ohio is really looking out for the city of Cleveland at something. So, give me this. Come on.
To the chair, the governor has proposed a number of different options for the state to manage this. The State House passed preemption to take away local control. City of Cleveland joined 18 other jurisdictions to sue the state to be able to do local control. With the argument that the state has no statewide enforcement mechanism. The judge at the local level and now in the appellate court, we're waiting on their decision, but the local one sided with us in saying that the state doesn't have a statewide framework at this point, and they sided with the cities to overturn preemption. And we're hoping for a favorable decision in the appellate courts that had good hearings. And so, through the chair, we're with you. We talk to the state health department all the time. They want to know what we're seeing, but they're just information gathering at this point until there's more legislation.
Okay, before I move on to my next question, my takeaway from that is that the determination that the state could not preempt the local control, the state's determination is that anybody can call anything a dispensary because it comes down to local enforcement. So is it that there is no state mechanism to correct, to find someone for characterizing themselves as a dispensary, or that there will never be because that comes down to local control?
Oh, through the chair, so the decision from the judge was that the state has no statewide mechanism. We all believe that there should be a statewide mechanism in the meantime, because there isn't, that's why we're bringing this local legislation to you.
Okay. Go ahead.
Just another point to add is that this is coming up a lot beyond the dispensary. I've received a few applications now calling smoke shops candy shops. So I have reached out to our law department to talk about, in terms of the First Amendment and how, obviously it's normally time, place, and manner restrictions, but there's design review that a lot of these signs do go through on one hand, but at the same time, when we are falsifying or calling ourselves something that we are not, is there ramifications for that, and is there a way that the state can regulate it? Because I think there's a real concern when you have smoke shops on top of this legislation now calling them candy shops and actually using branding similar to Sweeties, when that is really not what these places are and how that affects the children in our neighborhoods.
Okay. And as I'm sitting here, I'm Googling Ohio Revised Code candy. Because this seems, I mean, it's a BS argument in my opinion. Like these are defined things. Like I am not 6'5". Like that is an easily refuted fact. But before I get on, because I know I'm taking up a lot of time, in your understanding of what we're proposing, if the state did have a stronger enforcement mechanism and an entity were to receive a citation from the state, but maybe not the city, would that become an obstacle in them obtaining or renewing a tobacco retail license?
Through the chair, yes, that would be, if they're in bad standing from the state or the FDA, then we would, that would be an obstacle for them.
Thank you. Moving on, I'm also intrigued by the idea of a cap. I know that we are creating a de facto cap with the geography, and I'll say I've been advocating for years for a cap on the number of gas pumps in the city of Cleveland. We have these extractive businesses, as Councilman House Jones says. These individuals, more often than not, do not live in the city of Cleveland. They are selling substances to low-income people. They are treating our community as some sort of colony that they can extract wealth out of, and I don't have a lot of patience for it, and I think that we need to have a realistic view of what a city with this population can bear as far as like the proliferation of any sort of retail. I think that that's a valid point of discussion. But I will say that my interest in a cap is almost, and this is what I would like to explore, Ms. Aston, is let's say there's 400 locations right now. Would we be able to cap at 300? 100 of them are effectively grandfathered, but if things close, we're not creating a scenario where people can sell because we're trying to bring this back down to a balance. This supply is, in our opinion, so exceeding demand that we have to rebalance this equation, and capping may be the opportunity to do that over time. Does that question make sense, Ms. Aston? Can we knowingly set a cap that we are already in excess of, would be the question. In addition, a lot of my questions were about the grandfather clause. So, for example, I believe one of the smoke shops in Ward 17 has apartments above. So you may be grandfathered in, and you happen to be too close to a school, but are there other extenuating circumstances where we might say, like your grandfather, we can't give you an occupancy essentially because there are other extenuating circumstances like having a housing unit above that these are incompatible uses. So I guess that's an example, but the question is about how broad is the grandfather clause? Is it universally applied, or would there be cases where under this there are locations that would have to cease to exist for any number of reasons?
Through the chair to the councilman, the grandfather clause or non-conforming clause is that if you're legally existing, meaning that you have a use permit in hand and you're legally existing at the time that this ordinance passes, you're grandfathered in. So of those 400 that you have heard about, the only ones that are actually permitted are the ones that have come in the past 6 months or so and actually gotten a use permit to be a smoke shop. Because the Building and Housing Department did not keep those records prior to this ordinance being introduced.
Okay.
So let me ask a question, Councilman, on your point. Let's say, like, go back to the smoke shop in Councilman's Life Ward. Let's say they purchase, could it be a cap on how many they can purchase, or are we going against their rights? For example, you have this smoke shop, and they own 4, maybe 5 smoke shops throughout the city, or 10 smoke shops. Is there a way we can limit them to only 1, 2, or 3?
To the chair, do you mean by owner?
Yeah, by owner.
I think that's
Say
a
that
question.
owner owns that in Councilman's Life Ward, but then they purchase, they're making so much money.
They are.
They turn around and purchase 4, maybe 5 other smoke shops.
So-
And even in the flea markets. And how do we cap that? Because you could start a monopoly.
They have.
Yeah, I mean, you have one person and they control so many, then you could end up with other issues down the line, Counselor. So let's take a look at that as well.
Okay.
We got that.
Agreed. So one of my initial, and back to kind of the one that was by the school, one of my questions, and I can hear already Ms. Aston in the law department saying that would be viewed as a tax. But if there are, let's say I was almost thinking of like a graduated scale of licensing where like if you're grandfathered in but you are within 200 feet of a school, an all-boys school like this one is there a higher fee because you are incurring a greater impact on the community and there are additional things to check against to make sure that K-8 boys aren't walking down the street and being incentivized to purchase. I would like to think that that's something that we could happen and that there's a way that we could use the licensing to even discourage the locations that may exist from operating. However, I guess my bigger question is, to your point, the law department's point earlier of we can only charge what it costs to administer the program. Not throwing anything against anyone or any department, but I think you can hear from this side of the table that we feel that there continue to be challenges in administering what we have. So I guess the question is, I accept that I can accept a world where we can only charge what it costs us. My question is, should it cost us more to administer this? And do we need to look at a more aggressive program that would add costs to what we are charging people for a fee, but it is right-sizing what it actually takes? Because I'm thinking we need more inspectors, and I'll tell you, when it comes to zoning things, we need an after-hours crew. So many things. Go ahead.
I am, no, for
Lightning
real,
rod.
for real. I have been no less than 2 to 3 years with the administration, specifically in the Economic Development Department, pushing for a nighttime economy team. I have asked for that, for a team specifically to work from 9 p.m. to at least 4 a.m., not in a public safety manner, in a business sector. We need people up that can establish relationships, find. So again, I wish if you want to come on board, I know this was a conversation I began to have with Councilman Starr. We were working on it, and Councilman McCormick. We have put this information out. There are other agencies that do it. This was, again, because I am a systems thinker. When I heard that people indicated that this is going on, we need a nighttime economy team to work between 9 p.m. and 4 a.m. because of all of these things that are happening that we have no idea what is going on. It's after the fact, and we need things in a real world sense. So I thank you for bringing this up. Hopefully people will work with me, and by the time we have the next budget for the administration, we are actually going to, when budgets are due in September of this year, we will completely have the investment for a actual team to work in a nighttime economy manager, and versus finding ways that we can't do it, seeing the need and all the different things that cities are evolving, And we absolutely need a team of people working at nighttime. Thank you.
Sign me up.
Madam Chair, may I steal a moment from, for Councilman Slife?
Sure, and then I swear I'll wrap up soon.
Okay, yeah,
If-
I think, and I'll,
No.
here's what I'll
It-
say. What you're hearing is like enthusiasm from this table, so we're all leaping
Yeah.
on top of each other. But just to clarify, we are on Councilman Slife's time, and you very, very gracious with yours,
If-
Councilman Harsh. So absolutely, just wanted to clarify where we are.
Thank you, Madam Chair. Through the chair, if the question is that the licenses must reflect the cost of the program to the city of Cleveland, then perhaps through the chair, we could consider the cost of tobacco health effects on the city of Cleveland.
Yeah.
And if we were to include the health effects of tobacco on a Cleveland, then we could potentially justify a much larger licensing permitting cost. That's all.
Thank you very much.
Through the chair, my text messages are telling me the same thing. We do currently fund tobacco cessation programming and health promotions, and so we can roll that all in. Yep, thank you.
So, thank you, and I think I'm at the end of my bullet points. It was that short, but I think that I really do want to aggressively understand what our true costs are or what they need to be. Again, understandably, we kind of function under this culture of austerity because we have to have a balanced budget. And I always talk about, we have to live within our means, but when we're so focused on having to live within our means, we're not thinking about what we would want to do if we had more funding available. So if this is an opportunity to create that funding, that's great. And I love the idea of a nighttime focus, because that does sound like there's a carrot and a stick. Look, I have a great little restaurant, and this time of year during Ramadan, it's open from like 3 p.m. until 2 in the morning, because that's when people are going. So in our traditional setup, we don't have people maybe that are as easily get to go engage with that business owner in a positive way, because that's a positive relationship. But at the same time, we've all struggled with late night nuisances, and we haven't had the enforcement mechanism when it's necessary at a moment's notice. So I do think that there's a carrot and a stick with coming up with that sort of program. So sign me up. I'll stop.
Thank you, Councilman Slife. Councilwoman House Jones, this is your official time. I apologize.
Thank you. No, it's going through. So I'm going to work as quickly as I can. So through the chair to the team here, can you talk about how, when we think about the administrating of this new industry, how does that compare to the current capacity of administrating currently between planning and public health? And is building a housing in here somewhere too? Yes. Okay, so tell me, how does this compare to the current capacity of the varying entities that are going to administer this versus when the implementation of this goes? What is going to change? How is it going to be effectively administered?
Okay. Through the chair to the councilman, I'll talk about the zoning piece. But the way that this really won't change, what has changed in the course of the last 2 years is that zoning has moved into city planning in terms of zoning review of commercial and residential projects soon to come over the next year. But however, anything that's a smoke shop specifically will require a use permit to operate as a smoke shop. So those are all your gas stations and things of that nature. If they're within 10,560 feet or the 2-mile buffer of one of the ones that have a current use permit, we'll have to issue them a letter of nonconformance, and they will end up at the Board of Zoning Appeals if they choose to appeal the denial letter. And then within that, working conjunctively with the Director's Department in terms of public health, requiring that annual license, how that'll help in the future is for us to really be able to really understand how many smoke shops are truly out there beyond, the internet searches or what's currently permitted, because they will require the tobacco license across the board, not just things that are delineated as smoke shops. But they would also probably have the enforcement hand to help understand where and when those complaints come in through 311, through Building and Housing and to the Department of Public Health, be able to track what's actually out there if we don't know that it's out there because they don't have an occupancy permit. Or if they seek a license and they don't have an occupancy permit, and they come to the Building and Housing Department to submit a building permit and go through zoning and find out, hey, we're already within, the 2-mile buffer of another, then they would be denied essentially that. And if they don't get their occupancy permit for the smoke shop, then they wouldn't be able to get their tobacco retail license. Okay, that's
So
I missed.
just through the chair to the team here, this is the fundamental problem, right? There are no less than 10 that are illegally operating. I'm just talking about in my neighborhood. 10. We have no enforcement. Like I really need you all to, how is this being enforced? Like, again, and I guess my first question is through the chair to the team here, when was the first smoke shop established here in Cleveland?
Through the chair to the councilman, honestly, I could not tell you when the first smoke shop started, or tobacco retailer started selling smoke shop products. But if we don't know where they are, right? So they have to
So
be
how do
reported.
you, and so I guess this is my follow-up, through the chair to the team here, how are you going to know about smoke shops right now, based on when this comes in? What is going to happen that will let us know we have smoke shops?
Through the councilman to this, through the chair to the councilwoman, we would ask that residents and leaders and people in the neighborhood call 311 or send an email to, you can send it at zoning@clevelandohio.gov or building and housing at clevelandohio.gov, and we can respond and we can work with our building and housing and other partners in the city to handle the enforcement aspect to get them to submit an occupancy permit application.
So, if I may, through the chair, so yeah, that plus, we already have this map. You saw the map on this slide, this one. So we plan on going out to every single one of those locations and letting them know about the new licensing procedure. Once they have a license, they'll be subject to 2 health inspections a year from a team that we already have in place. If they don't get a license, they'll get a cease and desist letter and a placard on their shop. We'll work with public safety to close them down.
Okay, yeah, we should come up. I think it's going to be really important for us to come up with a limit. I just, at this point, I understand people will have, because again, when people have been operating in a legal fashion, because that's the other thing is when we're talking about the use, how does that compare to like payroll taxes, things of that nature? So that I would be very very intrigued to understand what's the correlation, because that's the I would say the value proposition for the city of Cleveland. You have a business because we want to have a thriving business because you are fully participating in a system that works for us, right? Because you're paying payroll taxes, things of that nature. And again, just with the general payroll tax. But again, how many of these smoke shops are even filing their taxes that have payroll taxes? I think that should be the impetus of if you are granted a license, because then it lets us know that you are a legit business. And I don't know if we can answer the question today of all these smoke shops, are they paying payroll taxes? I want to please put that on there, because I do feel like that's a part of the permitting process. Like that's an indication of a legitimate business versus those who are not. And then through the chair to the team here, when we look, I know there was a conversation earlier about testing. So what is our process to make a determination if a business is operating illegally? When it comes to the product of saying it's candy, it's hemp, when it's cannabis. Yeah. Because again, and I asked you this question because from my understanding, what is happening with many of these smoke shops is that a lot of people are taking a drive up to Michigan and purchasing a lot of products and then bringing them back on over here to Ohio and selling them. That's what I've heard. I don't know if for certain, but based on movements and activities, it's a highly likely probability that they are selling adult use cannabis.
Yes.
Covered as whatever the other definitions are. That is happening. Hence, when I saw it was an address that pulled up, and I reached out to planning department and I said, why are y'all giving a license to a cannabis shop? No, it's not a cannabis shop. I'm like, yes, it is. It is. No, it's not. Okay.
You know what, Council Lady? They have distributors also. These shops, they have people that distribute to them and help them with other things.
Yeah, for sure.
over
And
the
again, but
internet.
it's a legal operation. And through the chair to the team here, it's understanding what is our proactive stance, understanding what is happening here in our city that is not a benefit in any form or fashion. It's not a benefit. We're not getting the payroll taxes. We're getting the complaints from citizens. What's the benefit? Tell me what's the win for us?
Nothing.
And so I don't understand why we are so pressed on making room and pathway for people who do not want to be good partners with us as a city. I do not think you should, which we'll get into my grandfather clause, but how are we defining something that's illegal?
Through the chair, you're asking a great question. We're going to work closely with Columbus and Cincinnati to figure this out, because you're right, we've never done this before, and so we're going to rely heavily on folks who have done the work to figure out what the best practices are to be able to do it.
Okay, just rounding out the end. Final, I guess, through the chair to the team here, we talked about the grandfather. Tell me, just explain to me, what is the value proposition in grandfathering somebody into a new industry?
Through the chair to the councilwoman. Oh, yep, sorry. Yes, so the grandfathering clause in the, it's really a non-conforming clause in our code, states that any existing use requires, and to really answer that question that you just asked concerning value proposition, there's probably really no value proposition in grandfathering in businesses that legally exist. And so when I was referring to the grandfathering or non-conforming applications that are streaming in right now, as in getting use permits from the Department of Building and Housing as a smoke shop, those would be the ones that would be quote-unquote grandfathered in when this legislation passes.
Through the chair, why?
But I understand your
No,
question.
no. I feel like this needs to be a part of a legislation, and that's why I asked the question, when did the first smoke shop happen? And I'm specifically talking about, Ryan, this cannabis, whatever the lack of the definition is what is the value and why do we have to grandfather anyone in? Why?
Through the chair to the councilman, I understand your question. I will work with our law partners in the law department to ask if those applications that come in. I understand.
And the reason why, through the chair to the team here, this is a new industry. We didn't have no rules. Now we're saying there's some rules. We can't even, and like I said, when I'm asking the question, well, how many do we have licensed or we don't even know. So that's the question through the chair, through the team here, based on the uses, because people get a occupancy or use. Do we have the number based on the licenses for use or occupancy that correlate to smoke shop? Is that where that 400 to 600 is, based on the licensing that we do have, our permitting that we do have, or this is just based on, where did this come from? Tell me, what's the story of this? Oh, this is new permits, existing smoke shops. So that was from 2024, which is no, that's not the same. No. This is not the same one compared to the other one.
Yeah.
What's the difference?
So this particular map here is the permits that have come in the past 6 months based on the Department of Building and Housing, once this was introduced, starting to label use permit applications. When people ask to change the use, they specifically ask to change their use to a smoke shop.
And how many of what's the number of this?
The number that came in up till the prior planning commission was, I believe it was 45. I'm now up to close to 75 since January 1st. since we've been putting it in. And then the 400 number that I gave you earlier is what we guesstimate from Google searches, reports, things of that nature. And then the 600 that he was referring to, the director was referring to, is in terms of tobacco retailers that they know exist within the city of Cleveland.
Okay. So what, go ahead, yeah.
I think I'm seeing two versions of the question you just asked. So I guess what are the requirements around grandfather clauses? But also, I would be interested in knowing, we do not typically pass zoning legislation under emergency authority. Could we get an outline from the law department about emergency authority vis-a-vis zoning legislation? No comments. If you could just provide, or if you're able to give us that in writing an analysis of the limitations on that. So thank you.
Through the chair to the councilman, when we did small box discount retail, they passed it as an emergency ordinance so that once it passed the council for that third reading, it was available within 10 days.
Thank you.
And
You're trying to get this legislation through because you see when you saw the 75 came in, and if we hold things, that way you have some kind of teeth. Is that correct, Director? I mean, I'm sitting back looking at you.
Through the
doing
chair,
it,
that's
and
correct.
if we do our amendments,
Yep.
we can do our amendments as long as you have a framework in there, so that way you can get your people out counting, and you can start putting systems in place. That's what you're looking at. Is that correct?
Through the chair, yes, and the zoning piece just needs to go through DPS, which requires 2-week notice for that meeting, and so that's the
Because they're moving very fast. They know that he's pushing it, and they're moving fast.
we're pushing it through the chair. That we're pushing.
You
Yeah.
champion it. All right, I know we're pushing it.
And I know I'm coming to close to my end through the chair to
Analyzing you.
to the team here. As we talk about the understanding the evolution of words and industries of science, if our requests, I know we were talking about the difference, cannabis, Delta 8, all of the things that you cannot name, is there a way to define, or just in a very general sense, products that can be inhaled, smoked, whatever, for the purpose of legislation, so that we do not get caught up into, oh no, my specific thing is not listed, because there will be a new iteration of this that will not be defined. So how are we addressing that?
Through the chair to the councilwoman. So it is addressed in the smoke shop legislation under 347.21.
You said 340,
7.21.
okay,
It's
oh,
the
18, okay,
ordinance
I'm looking at it.
188. If you're reading through the definitions, it kind of goes into, the names of some of these products, but it doesn't limit it to these products or these names specifically.
Say that again, it's what, 3?
It's the ordinance proposal of 188, 2025.
I understand that, but
Sorry.
tell me
The section that we're proposing to add it in is under 347.21.
oh, under definitions?
Yeah, under definitions, in terms of, it defines CBD, electric smoking device, hemp, kratom, smoke shop, and then the smoke shop product in number 6 is any product containing, made of, or derived from, or containing any form of CBD, et cetera, including but not limited to.
Is that how we're getting through it, but not limited to?
Yeah, and then,
Filters, rolling papers, blunt, or hemp wraps, or pipes?
or ingested by any other means, at the bottom.
Where's that? Okay.
In 6A,
6.
and then 6B. So
Maybe I missed, hold on.
I apologize for going too fast.
6A.
6B.
Okay, I see it's 6A. Okay, all right,
It goes on all the way through to D. And
all right.
then-
Yeah, I see that part. It was
Okay, perfect.
And then the final thing is, sorry, last one, through the chair to the team here. Can you discuss the structure around penalties? How is it defined to have a certain amount of penalties, and why did we choose to increase the penalty within 36 months? I'm at 187. I'm talking about 187 now. Why was it, why that time duration? Why this fee structure?
Through the chair, we try to adopt best practices from other cities, and so, but definitely open to accelerating those time intervals.
Okay, through the chair, what is the understanding of what is the best practice of a violation within 3 years? I'm trying to understand that. Where did that best practice come from?
Through the chair, we worked with the Center for Public Health Law. We worked with the city of Columbus and a number of other cities. And so, but again, this is absolutely open to accelerating that.
Okay,
narrowing that
just through the
timeframe.
chair, I guess this is a question, a request. Can you define or summarize where the best practice came from based on the penalty, the time duration, and fees? Just summarize what it actually came from and what makes it a best practice. Thank you.
Yeah, were you finished, Councilwoman? Council lady?
Thank you very much. Director, I know you've mentioned a couple times the work from Columbus and Cincinnati. Could you share a little bit about where they are in their process of regulating smoke shops and tobacco retail licenses, and specifically whether they have set up a testing system to test marijuana products for compliance with the Farm Bill? Through the chair.
Through the chair, so they're very advanced in their tobacco retail licensing. It's been in effect for a number of years. I don't have the answer on the testing piece, though, and so I will reach out.
Thank you. Yeah, if that could be a follow-up, that would be great.
Could you write that down?
I did already. That was earlier.
Come back to us. We have several things, and you and I, we will get to, let me put this on. Director, we will meet on follow-ups with council member, with my colleagues have request of you, and you have to reach out to the law department as well. Oh, Councilman, did you have a question? I'm sorry.
No, go ahead, finish.
Oh.
I'll come.
Yeah, I was doing a wrap-up, so I'm
Oh,
going to
no,
listen to you.
I have something to say because I came in late, so I'm sorry.
You don't have anything to say?
Yes, I do.
Oh,
I
I
have-
want to yield to you.
Okay,
then I
you're going to
can-
wrap it up? Okay,
Yeah.
thank you.
We need
All right, thank
reflections
you.
on it.
All right, thank you. I'm sorry for my tardiness, but I do have just to echo some of the comments that my colleagues had said, and also from your presentation, I just want to ask a couple questions, Chair, to the team. When on one of your presentations, you had up there, if a smoke shop should not be in 2 miles of each other. Okay, when the uses of the variance is submitted to the applicant that is acquiring the smoke shop, Chair, to the committee, to the team, how do you determine that by address before that permit is given to a new smoke shop that is recommending to be on the same street of another smoke shop that's less than 2 miles of a smoke shop? Do those addresses come up before you give that uses variance to that smoke shop? Chair, to the team.
Director?
To the chair, to the councilwoman. In terms of the mapping is based on, and if we follow up with the law department, based on Councilwoman House's question, if in fact the smoke shop permits that have come in will be grandfathered in, it's going to be based off of those permits that legally exist at the time that application comes in. And so our GIS person is mapping where the permits have been given. And so if something, let's say, for instance, an application comes in for Store A, and it's near Store B, and Store B has a legally operating occupancy use permit on file, then we would deny them and send them, if they choose to appeal the denial, we'll have to go to Board of Zoning Appeals, where the community and the city can weigh in. If it's, in fact, let's say Store B submits an application, and we don't know that Store A and Store C exist, and they don't have an actual occupancy or use permit on file, then we would be able to give them their permit. And then it would be up to the citizens and others to report that, hey, A and B are existing. Do they have an occupancy or use permit on file and a tobacco retail license on file? And if they don't, then they would have to follow that same process and submit applications.
Okay, all right, that's a good answer, because I think that's also an understatement, because their smoke shops are operating right now, that's in less than 2 miles of each other, and also around an organization that has, an organization that's providing service for children, and also there's churches on the street too. So I myself have already communicated with a couple of owners who have opened up their smoke shops in Ward 4, and I can understand why you less than a mile apart of each other. And due to the owner who own the building and leasing it out, the owner should be aware that they cannot lease out to a tenant who want to open up a smoke shop, knowing a smoke shop is less than a mile of a smoke shop, less than a mile of churches, less than a mile of organization that that house children in that neighborhood as well. So I do have those addresses, and I will be sending those to you, because that needs to stop, because that is unacceptable and accountable. When we got organizations with kids coming in and out, and we got 3 and 4 smoke shops across the street from each other, and churches in that area too, that's why this has to be a more diligent check with the GIP map, because there's no way these smoke shops should have been even granted that use variance if you have that map. There's no way. And they popping up like wildfires in a neighborhood that never had them. Now we have 4. And that's just unacceptable. And I do my homework, so I will be sending that, because you already explained that process to me, and that's why I went out and did my homework. And I see what you're saying now, and I'll be sending that information to you as well. So that was the question I wanted to ask. Thank you. Okay.
All right. Is that, let me ask you this, Director. She should be sending that to you also, to both of them.
Yeah,
Right, because he's going to send some people out there to take a look at it, Council Lady.
through the chair, yeah.
The Director, sorry for pointing.
Once we have the legislation passed.
Right.
Yes.
So I need feedback on that. And knowing Councilmember Chris Harsh and my other colleagues, they're going to probably look at it, and you'll get some motions in the end, or maybe even some amendments. Probably when you get to the Finance Committee or whatever, or over there with Council Chairman Anthony Harrison. They're just going to study it, but we need the question to ask you so I can give it to my committee.
Yep. Yeah, through the chair, I have, how are we going to actually test the different products chemically in a lab? Can we limit the total number of tobacco retail licenses if granted? Can one owner get multiple licenses even after the restriction goes into effect? Can we do a higher fee? How do we know if a smoke shop or tobacco retailer is collecting income taxes? Do we even have to legacy in existing tobacco retailers? And summary of some best practices from other cities.
How soon can you get the feedback for us? What they narrated to you, Director?
Through the chair, so if DPS has to do a 2-week notice, I'll definitely have that information by the time of the committee for DPS.
All right. Yeah, I'm coming to the, I will attend the DPS meeting. I'll be there. Council Lady?
Yeah, I'm sorry, just one last question to the chair, to the team here.
All right.
Would it be possible, as you're exploring other things, to look at similarly? I know there are some cases where voters in a specific precinct or geographical area have to vote on if an establishment can establish like Sunday sales or something like that for alcohol. Is it similarly to explore what would that look like when it comes to some of the smoke shop stuff? Yep. Like a smoke precinct or something like that, if people want them or not.
Right.
Because again, when you don't have to live with the ramifications, it's good to just put stuff out there. And I do feel like, I don't know what that looks like, but I just it just came across my mind. So something to consider. Thank you.
And I did ask you about the liquor license as well as the smoke shop license. You have that in there as well? All right. Any other questions on these ordinances? All right, I'm going to go one at a time for the ordinances to be approved. Ordinance number 188, 2025, by council members Conwell, Griffin, Santana, Casey, and Jones, to enact Section 347.21 of the Codified Ordinance of Cleveland, Ohio, 1976, relating to smoke shops. 188-2025 have been approved by the Health Director, Finance Director, as well as the Law Director. Was there any other questions on this?
Chairman, could I be added as a co-sponsor on all four?
All right. We'll do that.
The whole committee? All right, let's all get on it.
The whole committee. Yep, the whole committee. All right. Batter up, and then we'll kick it back down. Now, ordinance number 186, no, 189. Let me do 189 after that. Okay. Ordinance number 189 by council members Conwell, Griffin, Santana, and Casey by departmental request. The ordinance was a supplement of the Codified Ordinance of Cleveland, Ohio, 1976. It was enacted in new section 350.121 relating to window sign coverage, limitation to amend section 3104.02 by Codified Ordinance as amended ordinance number 388-2024. It was passed April the 1st, 2024, relating to civil offense. I'm just rereading this again. Approved by the Health Director, Director of Finance, as well as Director of Law. Any other questions on ordinance number 189, 2025? So move. 186 is next, that we discussed also again. All right. Ordinance number 186, 2025 by council members Conwell, Griffin, Santana, Casey. It's an emergency ordinance to amend section 607.15 of the Codified Ordinance of Cleveland, Ohio, 1976, relating to illegal distribution of cigarettes, other tobacco products, or alternative nicotine products. It was approved, as we discussed, by the Health Department, Finance, and Director of Law. Any questions, other questions on this? So move. Last one, ordinance number 187, 2025 by council members Conwell, Griffin, Santana, Casey. It's an emergency ordinance to supplement a codified ordinance of Cleveland, Ohio, 1976 by enacting a new section 235A.01 through 235A.11 and 235A.99 relating to tobacco retail licensing. It was approved by the Health Director, that's you, the Finance Director, as well as the Law Director. Any more?
As there's an amendment on this one. Do you have that amendment that you need to read into the record? And
Who did the amendment? I didn't do it.
it was attached before the hearing this morning.
Was it a scratch amendment? Where was it at? There's no legal objection. This legislation is supplemented by codified ordinance. Where's the amendment in here? It's in section 1? To strike it?
Mr. Chairman, it says, if you'd like, I can read what's attached to mine as the amendment. There is no legal objection
All
to
right, read
this
it.
legislation if amended as follows. Number 1, in section 1, at section 235A.06B, line 1, strike, quote, authorized agent, end quote, and insert, quote, agent, small letter A, end quote. That is the amendment.
Mr. Amendment. Is there any discussion on that amendment?
No.
No discussion on the amendment? So with that up, it's approved. We'll move forward. All right. Director, and I will get with you. And thank you. I'll get with you on this, when you think, this week?
Sure.
All right, we'll
Sure.
discuss it and
Okay.
we'll move forward. It's going crazy. You said that it was going to be a lot. You said that. You said, Kevin, when we move this, Councilman, And it's 75? I didn't think
I
75.
don't either. It's awful.
Wow,
awful.
that's horrible.
It's awful.
With that, the Health Committee is adjourned for today. Thank you, and have a good day.
So we'll check with DPS.
Yeah, we'll visit in DPS, and I'm gonna talk to them.
Of course not.
Okay.